this is Dr. Kim. I hope you guys are doing wonderful and staying safe. I wanted to just put out a little bit of information for my patients that are pregnant or breastfeeding as it relates to COVID-19. I have a special person with me, Kelly Scare. She's a part of our practice. You guys might not know that I spend quite a bit of time evaluating infants for tongue tie and lip tie, specifically as it relates to breastfeeding. So Kelly works with me. She's an infant feeding specialist, whether it's breast or bottle, or purees and solids. So tongue ties can have a big impact long-term and short-term. Short-term for breastfeeding issues or moving to purees and solids and suck, swallow, breathe. And then more long-term, airway is a big deal. And anyone who's ever been in my dental chair knows how passionate I am about the airway. And it all starts in the very early stages of life, how that tongue develops the palate, and it can lead to constricted arch and constricted airway, changes the whole craniofacial structure. So I'm super passionate about it, and I love it. And I feel for our mommies right now that are trying to take care of infants and toddlers, or they're pregnant and they're scared. And I just wanted to give you a little information. I'm going to let Kelly talk a little bit about that. Go for it.
Hi guys! I know this is a stressful time, and so we want to provide you the best, most current information that we can for breastfeeding and COVID-19. All of the organizations, CDC, WHO, everybody is in agreement that we want to continue breastfeeding, or we want to initiate breastfeeding if you have a new infant. Breastfeeding is a massive protective measure for your infant, whether you have symptoms of COVID or not. The environment that they're around, the toddlers running around your feet that are bringing in lots of germs, it is going to protect them. So if you have an infant at home, stay breastfeeding, whether or not you have symptoms of COVID. If you do get symptoms of COVID, there are a couple of things that we want to encourage you to do. Number one, we want you to wash your hands prior to breastfeeding and wash your hands after breastfeeding. Continue skin to skin care, continue breastfeeding. We want that baby nursing. Number two is if you do have symptoms of COVID, if you're coughing, we want you to try and cover that mouth because your baby is in very close proximity to you. So the best way to protect is to wear a mask, wear a bandana, cover your mouth with a shirt, something so that you're not just coughing directly into your baby's face. Number three, if you're so sick and so exhausted and those flu-like symptoms are very real and you cannot breastfeed, we want you to move that milk. We want you to be pumping or hand expressing every 3 to 4 hours. If you don't know how to hand express, it's much easier than pumping and it's twice as effective. There are lots of great YouTube videos, or we can do a telehealth visit and I can walk you through how to hand express. It's extremely important to keep moving that milk so we don't lose supply during the times when you feel the sickest and most exhausted. There are lots of things that we could talk about right now with tongue and lip ties, and you may be home with a 2-day-old and breastfeeding is a struggle. It's exhausting and you feel like something is off. That's why we're here. We want to help you through all of the symptoms. We want to help you through tongue and lip tie if you need that help. So Dr. Kim is going to talk to you a little bit about what our process is at our office specifically and how you can get a hold of us so that we can be right here with you through this journey. We love y'all, and here's Dr. Kim.
So we're mandated by the governor. We cannot see any patients other than emergencies, and it needs to be medically necessary. So we feel like some of these mommies and babies may have a medically necessary need. You know, if a baby can't feed, then
gain weight.
Yes, baby can't feed, baby can't gain weight. Mommy's having so much pain, she might get mastitis. We don't want mom to go to the emergency room. We don't want baby to have to go to the emergency room. So we feel like this could really be medically necessary. Not all cases. So what we're going to do is we're going to screen the calls. So call our office and then we'll get you in touch with Kelly. And Kelly also has a website, milkandmom.com. So you could go through that and contact her, or our office can get you in contact with her. So what we're going to do first is she's going to screen you guys, screen mommy and baby, because there's lots of things that she could do maybe over video, positioning and different placement of tongue and just talk through a lot of things with you. And you might be able to get by until this whole crisis is over. If not, if she feels like, you know what, this is something that we really need to see, then her and and I will come into our office. I want you to know I have all the PPE that I need to be as safe as we can be during this time. We'll definitely screen, mommy and baby and make sure, you haven't traveled. We have a whole form to fill out, take temperatures, things like that. I've been in quarantine. Kelly's been in quarantine. That's why we can be together. I have been nowhere. I haven't even been to the grocery store. So I'm keeping myself extremely safe in case someone needs me for an emergency. I'm there for dental emergencies, of course, too. So we just want you to know that we're there. Breastfeeding is it's so important, and we want to make sure that we're there to support you. And we're going to have a Zoom support group soon. We'll let you know when we're going to do it, just so it doesn't have to be our patients. Anyone who's pregnant, anyone who's breastfeeding that you know of that's scared or has questions, they can come in and spend, I don't know how long, maybe 30 minutes, and just ask us questions. Anything. It doesn't matter about breastfeeding. Just be breastfeeding and tongue ties. Tongue ties are a big part of my practice. I just feel like it can really be something that is so easy to fix and can be so good at preventing things long term. So I really want to get in the beginning. So we're just happy to serve you. We love you guys, and we're here, and we just are thankful to be able to even be in this role to help anybody we can.
Yeah.
Thank you guys.
Thanks, guys.